What's our pressure running there? 40?
40.
Okay, Dr. Up here and everyone else, as we look inside the knee, I got this guy, so I'm good, Kevin, thank you. And we see the kneecaps above us there. You got these crystalline deposits. I took a little biopsy of that to see if it could be gout or pseudo-gout crystals, and then we will just flush this out a little bit here. And a lot of the synovitis, you see the joint's pretty angry. There's angry synovial tissue all around there, which is interesting with your history of polymyalgia rheumatica, that whether there's an inflammatory condition going on here. So it could be nice to see if that's gout or not. And then we'll use our shaver and just trim that little bit. Here's the kneecap above us there. You've got some wear and tear, some arthritic change across the kneecap. See the fraying there, and the femur's below where the kneecap articulates, and that's got some wear and tear on it as well. See the roughness there. And we'll flush this out one more time and pop this out, and then we'll use our shaver. There you go, Kevin. And we're going to pop our shaver in here and just clean up that little bit of calcium there, or crystalline deposits. Okay, and not much we can do about the wearing of the cartilage on the patella and the femur there. It's we can make things a little smoother. Sometimes these bits will flake off and irritate, and we just smooth that off a bit and move on. So now that's the patellofemoral joint. That's up in the front of the knee. We'll come down the medial side of the knee now over here and come down. There's looks like maybe possibly a loose body or maybe synovial tissue there. Yeah, that's good. Thanks, Kevin. Right in the bag there. Okay, we're coming to look at the medial side of the knee now, and we'll flush that and see if we can get that to clear up a bit for us. And I think we'll need a shaver. Okay, so here's your medial femur above. You're getting some degenerative change there. You see the cartilage on the surface here is a little bit soft and delaminating, and then the meniscus here, medial meniscus there, is in between the femur above, tibia below. And we open up the knee to the back here. We just see again a little bit of crystalline deposit. So that's again pseudo-gout or possibly gouty crystals. And that can be contributing to some of your knee symptoms. Cartilage not too bad though otherwise. You see the cartilage here above and on the femur, tibia below don't look too bad, and the meniscus in between there looks to be okay. So this is the inside or medial meniscus, and it's not the one that we're as concerned about. It's the other side of the knee. I'll blunt a probe there, will you? And a probe. Okay, good. And we just want to make sure at the back of the meniscus here that we're okay. And no tearing. So yeah, no tears in the meniscus there. That all looks to be fine. So that's 2 out of 3 compartments. And then we come to the middle of the knee where the ACL lives, which is here. And it's your ACL. It looks just fine. We pull the leg, and that's nice and stable. Go to the lateral or outside compartment of the knee over here. And this is where we have suspected more trouble. And here's your lateral meniscus, and the cystic stuff we had seen is kind of up into here. See if we can open up the side of the knee better to see in there. Okay, so another pretty good sized chunk of crystal. Grasp it, please. So again, we're seeing these kind of signs of chronic inflammation, crystalline deposits. A lot of us, when we have some arthritic changes, we get these pseudo-gout that forms. What's all this leaking going on here? All right, then we see the meniscus in through there. We'll get our shaver in here and clean that up a little bit. You see there's definitely tearing to the back of that meniscus. Okay, so torn lateral meniscus back through here. Hey, Dad, could I have a little reverse Trendelenburg, please? Yeah. And here's, again, as we look across the knee there, the femur above, the tibia below, and meniscus in between. And we're going to get that cleared up as best we can to show you better. And a probe there, Kevin. So this lateral meniscus is kind of beaten up, and that's what we suspected from the MRI scan and your symptoms. And we keep flushing that till we get it clear, and looking lavage if you need to, whatever we need to do to get it cleared up. And there's pressure lavage for a minute. So here's the lateral meniscus. The top of it's fairly smooth. The bottom you see has been torn all the way across here, and then as we come to the front, there's quite a bit more tearing and fraying and shredding up in there, and more chondrocalcinosis. So we're going to work on some of this, get it cleaned up for you, and see if there's anything there that needs to be fixed. We know some fluid has snuck out through that meniscus, and it made some cysts up through here, and we'll see if we can get some of that out as we take care of this and trim it and clean it up for you. Again, tearing all through that central part of that meniscus.